Hello, welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about male pelvic pain. So for all the males I see in the clinic for pelvic floor therapy, pelvic pain is the most common thing I see. If you look at some of my previous videos, we talk about bladder leakage in men, and that generally only happens after prostate surgery. But let me show you the anatomy. So this is looking at the bottom. So here's the pelvis of a female model. So we're looking at the bottom like this, okay? And so for men, so here's like the muscles under the penis, around the rectum. For men, often they tell me it feels like I'm sitting on a golf ball. Sometimes it's common, like tailbone pain is a little more common for men. I mean, women get tailbone pain too, but for more the specific pain in men. But often it shows up as a discomfort with sitting. And so if we look at the pelvic floor muscles, it's sort of like, generally we don't really work on the muscles of the penis. There's not a whole lot to do. But sort of these muscles, it sort of is like the base of the penis and around the rectum. We can feel them internally rectally, but often in the clinic for men, I just work externally. But it's sort of like these muscles get tight. So this is the bottom. Like this is, if I'm sitting, how I'm sitting, that's kind of how it is. So we're looking at the bottom. So you can imagine if it's tight in here, you're sitting on this, so it feels like a golf ball. And that's really what they tell me. And so we work on this, we work on stretches, we work on breathing exercises, and they get better. And so sometimes it can affect sexual function or bladder function, but most of the time what I see in the clinic is it just is pain, and mostly pain with sitting. So that's sort of like male pelvic pain, and it can get better with pelvic floor therapy.